The Limpopo Health Department says it is evacuating the Witpoort Hospital in Lephalale due to overflowing Palala Dam. Now, this follows recent heavy rainfall. Let's get more details now and discuss the implications of this and how the department plans to minimize disruptions. Pimani Baloyi, SABC News reporter, is joining us for more on this. Pimani, good evening to you. Thank you so much for your time. So, how does the department plan on doing this?
Good evening, Bongiwe, and good evening to our viewers. The department has started the process of moving patients that still need medical care to nearby hospitals, while it has also been discharging those no longer needed medical assistance. But to speak more about that department's plan, let me bring in Mr. Neil Shikwambane, who speaks for the Limpopo Health Department. We've been to the hospital earlier. Mr. Shikwambane, thank you so much for your time. We've been to the hospital. We saw the flood lining. Water had subsided by the time we got there, but we could see the threat that you could probably led to this decision. Just take us through your decision. Why did you decide to evacuate patients from the Witpoort Hospital?
Thank you, Pimani. The decision to evacuate patients from the Witpoort Hospital was not thumbsucked. It was based on the advice that we got from the Disaster Management Authority in the area. Because if you look at the hospital outlook and the settlement nearby, it's not too far from that dam and the Palala Dam, popularly known as Dambot. So it's actually overflowing. So with the understanding that it continues to rain without abating, and the anticipation is that it might continue to rain for the next few days, there was an understanding that that could be precarious or dangerous for the hospital. Hence, we felt as a department that we needed to be proactive in order to save the lives of patients, of both the patients and also our employees in the area. We've then taken a decision to say those people who might need medical care from now going forward, they can utilize the nearby clinics, which is the Witpoort, Shongwane, as well as Silik. And those who need emergency care, they can then divert to Elisras Hospital. So that's where we are currently.
There are implications to this decision and the effect in terms of where can people go now for help. But also, hospital management told us that previously there was a time where water entered some of the wards, specifically the casualty ward, the general ward. What is the plan to ensure, because according to the weather service, it might continue to rain, and we do know that there are dams which banks have burst in that area. What is the department's plan?
I think currently we will rely on the contingency plan that I've already outlined, which is in the immediate, because we might not be able to address the long-term issues such as the structural engineering of the buildings and all that kind of jazz. We will continue to redirect patients, and we understand that there are implications to that, because some patients might need to travel where ordinarily they were not supposed to, but we request them to indulge us on that decision, because this is an extraordinary situation. Unlike if we continue to be stubborn and admitted patients and something terrible happens, we're thinking we needed to move the patients away temporarily. Once the situation has subsided, or rather gone back to normal, we should be able to sit down and say what could be the issues besides the issue of the dam bursting. But what you need to understand is that these kind of things happens mostly on the extreme, because the rain that has been received in that particular area is a lot. Even the last time when we had this kind of a situation, there was a lot of rain that had been received in that particular area.
Thank you so much. That is Mr. Neil Shikwambane, who speaks for the Limpopo Health Department. Bongiwe, we have been in that area throughout the day, and some of the challenges that we were told was that it's not just flooding in that Tabombeki settlement where that hospital is located, but the areas around that area where there are staff workers who work for that department who stay in Rasilik and other areas. And we spoke to the mayor, who told us that many of the roads in that area area are impassable. So staff members, not just who work at the hospital, but government officials are unable to move to areas around that area. The mayor earlier even told us that the Groblersbrug border post, which connects South Africa to Botswana, had to suspend some of its services due to the bad conditions on the road due to this flooding. As I was stating earlier, Bongiwe, the rain is expected to continue throughout tonight in that area and in the next few days, with residents that have been stranded. When we spoke to the mayor earlier, there were about 400 people that were located at a local community hall who would be spending the night at that community hall, with the mayor stating the public-private sector has gotten on board and is ensuring that these families are getting meals. They will get a roof for this night and other nights as these rains are expected to continue, Bongiwe.
And certainly, Pimani, that's what we talk about when we speak about early warning systems and the preparations thereof. Thank you so much for giving us that update today.